There are various common diseases that are widespread and affect many people, such as malaria, dengue, polio, diarrhea, hepatitis. Today, we'll focus on malaria, a disease caused by mosquitoes. In this lesson, we'll cover an introduction to malaria, its signs and symptoms, causes, prevention, and treatment. So, let's begin. Introduction to malaria. Malaria is a tropical disease, meaning it occurs mostly in hot climates. It's more common in the summer months and rarely seen in winter. Malaria is spread by mosquitoes, specifically the female Anopheles mosquito. It can be a serious and even fatal disease if not treated promptly. However, good news is that effective treatment for malaria is readily available. Signs and symptoms of malaria. What are the signs and symptoms of malaria? Here are the main indicators: high-grade fever, temperature over 100 degrees Fahrenheit, vomiting, sweating and shivering, muscle pain, headache, and fever that lasts between 7 to 18 days. If you notice these symptoms in someone, it's very likely they have malaria. It's crucial to consult a doctor immediately for proper diagnosis and treatment. Causes of malaria. What causes malaria? Malaria is caused by a parasite called Plasmodium, which is carried by the female Anopheles mosquito. Now you might wonder, why only the female mosquito and not the male? The answer is simple. The female mosquito needs blood to lay her eggs. That's why she bites humans to obtain blood. How does malaria spread? When a mosquito bites a person, it injects saliva from its salivary glands into the bloodstream. This saliva contains the Plasmodium parasite, which then infects the person. Prevention of malaria. How can we prevent malaria? We use the ABCD approach to prevent it. A for awareness of the disease. Learn about malaria, its risks, and how it spreads. Educating others is also important. B for bite prevention. Prevent mosquito bites by using insect repellents, covering your arms and legs with protective clothing, and sleeping under mosquito nets, especially in high-risk areas. C for chemoprophylaxis, preventive medications. If you're in a malaria-prone area or have been exposed, consult a doctor about anti-malarial medications to prevent the disease. D for diagnosis and treatment. Early diagnosis is essential. If you suspect malaria, get tested and follow up with a doctor for appropriate treatment. Treatment of malaria. What is the treatment for malaria? Diagnosis. The first step is to confirm the disease through proper testing. Recovery. The good news is that malaria is completely treatable and patients can make a full recovery. Medications. Anti-malarial drugs are used to treat the disease. Common medications include chloroquine, mifloquine, quinine and doxycycline, usually given in combination with quinine. Disclaimer: always consult a healthcare professional for the correct dosage and combination. Complications of malaria. What are the major complications that can arise from malaria? Severe anemia. Malaria destroys red blood cells, RBCs, which leads to anemia, a condition where the blood has fewer RBCs than normal. Cerebral malaria. This is a severe form of malaria that affects the brain. The parasite causes blood vessels in the brain to become blocked, leading to serious complications. Question of the day. How is malaria transmitted? Only a genius can answer in the comments below.